Hello universe, this is Gypsy. Thank you for visiting my channel. I wanted to talk today about my panning and makeup addiction. I am not immune to mental illness because I've spent over a decade working as a psychiatric nurse. In fact, I think that I had a lot of empathy for my patients because I had suffered a lot of the problems that they faced when they became inpatient and needed help. And I'm going to just pan through not just makeup, but products to show you the depth of my obsessive compulsive disorder. And this is what I was diagnosed with, was an obsessive compulsive disorder. I'm going to pause a lot throughout this video and talk to you about my experiences, just to open a dialogue, keep the conversation going about mental health issues, because I feel like I'm also an advocate for the mental health community. So, nursing school gave us a semester of psychiatry, and we were able to work on the floor in an observation mode to learn more about it. But quite honestly, it was a very confusing class, even though I could identify and memorize and understand so much of what they were teaching me. It wasn't until I went to work on the psychiatric floor that I really learned about all of our challenges. And quite honestly, 10 years in the field, and I always felt like I was learning something new, something more from every patient, every day, every shift that I worked. It was a constant learning process for me, and it enhanced my life a lot, the 10 years that I spent as a psychiatric nurse. I'd always had a strange relationship with my mother. She had survived the World War II, and quite honestly, probably had inherited mental illness from her father because his behavior was so extreme, so terribly extreme. He was a violent person. And sadly, those behaviors do spill over into the next generation if they're not addressed and treated. And treatment is an ongoing process. It is a lifelong process. And at some point in time, you do begin to see improvements and recoveries. And it is very slow, and you work very hard, and it's oftentimes you backslide, and oftentimes you don't feel like you're making any progress. It's just a struggle. But awareness that there's a problem and there's faulty behaviors is key. So my diagnosis was obsessive compulsive disorder. And I can see that through therapy, what I would obsess over would be the look or the fantasy. And that's what led to so much of this shopping and accumulation of product. So the obsession with the look, coupled with the compulsion, the compulsive behavior to buy is what led to so much of these products. And I had so many triggers still in my life. And it had to do with just, quite frankly, the brutal criticism all of my life that I grew up with. It's very difficult when your abuser is someone that you should rely on to be your biggest advocate when it's a parent. So you don't have your biggest advocate, and the person who should be your cheerleader, the person you should always be able to turn to for comfort and support, to make sense of the world, is the one tearing you down the hardest. Losing control and physically abusing you routinely, where you grow up walking on eggshells, not knowing what mood they're going to be in that day. So it carries with you all of your life, in every aspect of your life, and you become a parent, a mother, and you don't want to make the same mistakes. You want to learn and grow and be a better person and have the next generation not struggle like you did. You don't want to carry behaviors that you could recognize in your parent in yourself. And at some point in time, and for me it was decades later, you reach the point that you can forgive them and you want to have a relationship with them. And I can honestly say that it took decades to do it. But I did reach the point in my life when I could honestly say that I had a relationship with my mother. A good relationship with my mother. A loving relationship with my mother. 2 years before her death. And sadly, I did CPR on her as she died, which opens up a whole nother kettle of worms that you have to try to deal with. So a lot of the compulsive behaviors are shopping. You push down your emotions. You push down the pain. You don't want to acknowledge the pain. A lot of times it's subconscious. And you shop and you push it down and you rationalize what you're doing. You're getting bargains. Oh, you're entertaining yourself because you're home alone. And you shop and you shop and you shop. But what you don't do is deal with the emotions, deal with the pain. And it just grows and grows and grows until it comes to a head. And then you're forced to face it. And then you face it, and you feel like you've worked your way through it, and something else happens. Your daddy ends up on hospice, and you're his 24-hour bedside nurse until he dies. And you have to cope with that. And oftentimes the behaviors return. And your coping skills that you learned in the past oftentimes get pushed aside because you just don't want to feel the pain of loss. So really the pain was the trigger. And the compulsive behavior and the compulsive shopping was your Band-Aid. But you're not healing underneath the Band-Aid. You're just pushing things aside. You're not really feeling the feels. You're not really working your way through it. It's just festering and getting worse. And I think that you can see the level of my suffering by seeing the hoard of possessions. And yes, I own a business in addition to being a nurse. I'm a dialysis nurse at the present. Yes, I own a business. A lot of what's hoarded through this house is for the business. But it's insane. So I've identified my triggers. I have a history of going for treatment. I fully believe in treatment. I was in my early 20s the first time I went for treatment. I feel like it saved my life. My depression was so acute, I was suicidal. I had no coping skills. I'd grown up in an abusive home. Conversations about emotions did not take place because they didn't have those skills. So the therapy truly saved my life. And in therapy, I was given an antidepressant, which helped stabilize the chemical imbalance that developed. It balanced the dopamine, or it filled the need for dopamine that I was getting from the high of shopping. The counseling helped me develop the coping skills, the awareness of when I was pushing emotions down and engaging in unhealthy behavior. I was able to identify a lot of triggers, images of the perfect fantasy self, being triggered by collectibles, things that I thought had more value than they truly did, and underlying causes for me was boredom and loneliness and the lack of adventure and depression and anxiety and that history of abuse. I have to constantly monitor myself. I have to constantly check myself. I have to feel the feels. I have to be aware at all times, and it's difficult. It is a challenge. It is something I do all the time, and I backslide. I'm on a no-buy, and clearly you can see by the house and the storage sheds that I have to be. And I'm panning through the products, and I'm continuing to sell the art that I make. It's a daily struggle, living with it, feeling it. But this is a part of what I'm trying to come to grips with and how I'm doing it. Of course it looks like a hoarder home, but I know where things are for the most part, and I am working my way through it. I'm not throwing these things out. They still have value to me. They have value to others. It is a jumbled mess. It is craziness. It's my crazy, I'm going to own this. I'm going to work my way through it. And this is my panning journey. Thank you guys for stopping by, and have a wonderful weekend.